everyone, my name is Sarah. Random fact about me, I don't have a large intestine, and that is because I have Crohn's disease. I'm also an IBD advocate who runs a website and a YouTube channel.
My name is Dan Sharp. I am a Crohn's patient and an IBD advocate.
And that's what this channel is about. It's about my life with Crohn's disease. If you don't know what that is, then all the more reason to subscribe and figure out how I should. Can you say?
I'm trying to show that good information is accessible to patients. You don't have to be a scientist or a doctor to go and figure out this stuff.
Turn it on.
Oh, right.
Yay, we're rolling!
Now with the internet, patients can have a lot more information. I think that's the way the world is going. I've used a phrase previously that I borrowed from somebody, that it takes a village to take care of IBD patients. And to me, that village includes other patients.
Hi guys, we made it to Dan's parents' house.
That sounds so stupid.
Well, we can just end it there.
Crohn's is a type of IBD.
IBD stands for inflammatory bowel disease.
Really, it's a group of disorders or conditions wherein the immune system has an overactive response to something in the digestive tract and ends up causing inflammation and damage.
These aren't like any other chronic medical condition. Sometimes people call these the invisible diseases because they'll say something like, well, you look fine, you might as well be okay. Imagine then if you have a bowel condition that provides you with a lack of control or a feeling like you don't know what's going to happen next. You are unable to plan for the future, and you may not actually have people around you who understand it enough to help you or to support you the way you need.
I started advocacy in a weird way. It wasn't till like 3 years after my first 2 surgeries, but I ended up in the hospital again. So to fill my time and to feel like something was happening in my day, I just opened my computer one day and turned on my webcam and started talking to the camera and started sharing my story and uploading that to YouTube, and then it turned into what it is today. I think that it's important that the right story about IBD gets out there to the general public, and that's why I share what I do. I want to just break down the stigma that all we are is people that are running to the bathroom all the time, because that's definitely not my life, and it's not a lot of our lives. The more that I uploaded videos and I saw the response, and patients responded to it so well, I was like, okay, I'm doing a good thing, like this is okay, and it inspired me to talk.
My advocacy, something I'm really passionate about, is helping patients be empowered with information. I think the more that a patient knows about their condition, the better decisions they can make about their health, the better they can advocate for themselves in a healthcare setting, like they know what questions to ask, things like that.
The traditional model of patients learning about their disease came from a much more paternalistic relationship with their doctors. The doctor would tell them what they had and what they needed to do, and the patient either would do it or they wouldn't, but more often than not, they would do it. We evolved into the appreciation for shared decision-making, and shared decision-making was augmented by the growth of the internet. Now, at the same time, we also learned a lot more about how patients make decisions and the value of other educational fora, including YouTube videos. Now, whenever you open up channels of information, there's also the challenge of facing misinformation. Rather than be threatened by that, I think physicians and nurses need to be open to that dialogue and understand what's out there.
This is groundbreaking stuff.
Okay.
Okay, go on.
I know Dan and Sarah very well.
He's pretty much everywhere that we go. If we go to a conference or something, he's most likely presenting at least once there.
I actually look up to them and I respect what they do greatly. In fact, I think that they really believe, and I completely support, their role as saying, you know what, we're not part of the medical establishment, but we're informed and we want you to know that what you're saying isn't right, and what has been necessary in order for them to do that so effectively is for them to actually attend medical conferences, to not be afraid of learning the science and challenging the science.
And you know, I might not be a doctor, but I'm a smart person and I'm capable of learning a lot, so I put my time and energy into researching things, making sure I get the right information, and then I always check it before I publish it. I have a lot of doctors on the internet that have been so kind to me and let me message them late at night on Twitter and be like, hey, I have a question.
And I'm not afraid to give feedback if I think they're misdirecting people, because it's going to happen either way. You might as well be doing it and working together than having any kind of fear of what that means.
I always kind of joke around about like, well, if a doctor retweets it, then that means I did a good job. If they're saying that this was good information, then I'm like, yeah, it's good information.
I was taught by my mentor that all the research we do should start and end with the patient who suffers. And that may sound completely obvious, but the reality is that in research a lot of times it's not.
There are certain things being studied because patients in the IBD community are speaking up.
And so for years, what was the #1 topic on the internet that wasn't able to be answered sufficiently in the IBD research arena? I would say that it was diet related.
And there's a study going on right now through the CCFA that's studying 2 different kinds of diets and what effect they might have on inflammatory bowel disease. That's an area that a lot of patients feel are important.
But that I really think was a crowdsource. I think that anyone who's not paying attention to what's going on out there is turning a blind eye on the most important information that they could have about what research needs to be done.